Imagine for a moment you're watching a movie. Your younger sibling sits next to you and asks, "Why are these actors having bulging muscles? And why aren't our muscles like that?" So, what would you answer to your sibling? To answer that, you will have to understand and learn about hypertrophy. Hypertrophy is a type of cell adaptation. We shall learn about hypertrophy definition, cells in which it occurs, types, examples, and mechanism. So what is hypertrophy? Hypertrophy means increase in the size of cells, which leads to increase in size of the affected organ. Imagine a normal sized heart. If all the cells of the heart increase in size, then there will be an increase in the size of the heart itself. So I repeat again. Hypertrophy means increase in the size of cells, leading to increase in size of affected organ. Next, which type of cells does hypertrophy occur in? It happens in cells having limited capacity to divide, like skeletal muscles, or non-dividing cells like cardiac muscles. What are the types of hypertrophy? The hypertrophy can be physiological or pathological. Physiological hypertrophy is due to increased work demand, that is functional demand. Example, it might be skeletal muscle hypertrophy due to exercising in a gym, or due to hormonal or growth factor stimulation, like seen in uterus during pregnancy. Due to the estrogen acting on the receptors in uterine muscles, these muscles will undergo hypertrophy, and hence the uterus will itself undergo hypertrophy. Now, pathological hypertrophy. Pathological hypertrophy example is in cardiac muscle. Due to the increased functional demand, that is work on cardiac muscle, due to the valve disease or hypertension, there is hemodynamic overload. The heart has to contract with more force, so the cardiac muscle undergoes hypertrophy. Let's learn about the mechanism of hypertrophy in a simplified manner. Most of the studies have been done on cardiac muscle, so we will take it as cardiac muscle as an example. First, there is an increased functional demand or hormonal stimulation. This will cause an increased mechanical stretch on the muscles. These are detected by the mechanical sensors which are present on the cytoplasm, which will lead to production of growth hormones, agonists, example alpha adrenergic hormones. Now, this mechanical sensors, agonists, and growth factors work together and activate signal transduction pathways, which are actually a series of molecular events occurring within the cells to produce a response. These signal transduction pathways will activate transcription factors. Transcription factors are they control the rate of transcription and protein synthesis. Now, this will lead to the transcription factors work together and increase the synthesis of intracellular structural components, which are usually protein, which will lead to increased mechanical performance to manage the increased workload. To summarize and explain, hypertrophy is increase in size of cell due to increased functional demand, and the increased size occurs by production of more structural, that is intracellular structural components, which helps to manage the functional demand. Hope you like this video. Do subscribe for more. Till then, happy learning.